Hey guys, so let me introduce you to Peter McLaughlin. He is a 26-year-old accountant who is married to a man. He felt a bit sick one day, so he decided to meet up with his GP the next day. Here's what happened at the hospital. Doctor, I feel kinda sick. Okay, tell me more. Well, I've been having this high fever, this tiredness for the past 2 weeks. I've got this rash. I've got joint and muscle aches. And it's not from the gym, I'm sure. And I've got this flu. May I ask you a few questions? Okay. My questions are gonna be a little sensitive, but I have to ask to make sure that we diagnose it correctly, okay? Alright, sure. Are you sexually active? What? Yeah. Okay. Do you use protection? Nah, it doesn't feel good. Okay. May I ask how many partners do you have? Please don't tell John. Well, I have 3 other partners. Well, sorry, Peter, but we may need to tell him if this disease is notifiable. Hope that you understand. Okay, I guess. Do you know if either you or your partners use drugs? Yes, sometimes they use heroin, but I don't take part in those sessions. Okay, thank you so much for your honesty. We'll try our best to find out what this is. Can we do some tests on you to confirm? Please, and thank you, doctor. With several differential diagnoses on his mind, the doctor had to do several tests. One of those that came back positive was the ELISA test. It tested positive for a certain antigen. Also, the nucleic acid test tested positive for a specific nucleic acid. Furthermore, an antibody differential assay was done and it was positive for that specific antigen as well. So, what's your diagnosis? That's right, ladies and gentlemen. Peter is infected with HIV, also known as human immunodeficiency virus. His differentials would be common flu because of the flu-like symptoms that he's having, influenza, similar to common flu, and syphilis because of his fever, and maybe the rash. So HIV belongs to a family known as the Retroviridae family, and what's so special is it is a single-stranded but positive sense RNA virus. There are 2 types of HIV, HIV-1, which is more pathogenic and more likely to become AIDS, and HIV-2, which is less pathogenic and less likely to become AIDS. Well, we drew these viruses to look pretty cute, but boy, they ain't cute. The HIV virus has a specific antigen known as the P24 antigen, and this antigen was the one that was detected in the positive ELISA test that the doctor did. There are several factors that puts a person at risk for contracting HIV. Male-to-male sexual intercourse, which is more common than male-to-female sexual intercourse, unprotected sex, as well as needle pricks or sharing or blood transfusions of any kind. Patients diagnosed with acute HIV experience several symptoms including flu-like symptoms as well as a maculopapular rash. And these symptoms should only last for about 2 to 6 weeks. So here's why the HIV virus is so much more dangerous compared to the other viruses. As you can see here, that naughty looking HIV virus is about to infect a cell. In order to infect the cell, the HIV virus has to first bind with receptors on the cell surface. Now what is so interesting is that the HIV decides to infect not normal cells, but white blood cells. And these white blood cells are known as your CD4 T cells. So it binds to the CD4 plus receptors on the cell surface. Then the virus fuses with the cell membrane of the cell. When it fuses, it ejects its RNA into the cell cytoplasm. This RNA comes along with a special enzyme, and this enzyme is known as the reverse transcriptase. This reverse transcriptase is so cool because what it does is it's able to convert the RNA that the virus ejected into DNA. And this DNA will enter into the cell nucleus. Once it enters the nucleus, the DNA will meet another enzyme known as integrase. Just like the reverse transcriptase, the integrase is also released by the virus. This integrase will integrate the HIV DNA into the host cell DNA. So effectively, the HIV is transplanting its own DNA into the human cell DNA. The host cell, which doesn't know it is being infected, continues to replicate its DNA to produce proteins normally. But what it doesn't know is that secretly, the HIV has already placed its DNA along the host DNA, which means that it is producing the HIV's proteins for the HIV. Finally, these HIV proteins will be converted into virulent progeny, which is basically a baby HIV virus, by an enzyme known as protease. And once this happens, the virus begins to replicate, and as you can see, there are many babies coming out from the cell. This is how the HIV virus is able to hijack the human body mechanism to benefit itself. Back to Peter. Your results are back. Peter, I'm afraid I have to tell you this. You're infected with HIV. HIV? Like AIDS? Oh no. Is my life ruined, doctor? Well, HIV can progress to AIDS, but don't worry, your life isn't ruined. Here, let me tell you how HIV can transform to AIDS and how you can work to protect yourself against it. So, HIV is an infection. If you have HIV, it doesn't necessarily mean that you have AIDS. But if you have AIDS, it means that you were infected by the HIV virus. So a HIV infection is usually clinically diagnosed when the CD4 T cell count drops below 500 counts per microliter. Once this CD4 T cell count, which is your white blood cell count, decreases to way below 200, that is where you're clinically diagnosed with AIDS. So here's a chart to show you the progression of HIV to AIDS. So at first, Peter was healthy. One day, unfortunately, he gets infected. And once he gets infected, within 0 to 2 weeks, the viral load drastically increases because the virus starts to replicate. On the other hand, the CD4 T cell count drops rapidly because all the white blood cells are getting destroyed by this HIV virus. Then out of nowhere, your CD4 T cell count suddenly rebounds and the viral load decreases. This is what happens after 2 to 6 weeks when the viruses start to slow down and start to hide in the body. We call this latency. So during this stage, the patient does not show any symptoms, meaning that they are perfectly healthy. But the problem is they're infectious. This asymptomatic phase can last for many years, until one day, out of nowhere after many years, suddenly the HIV viral load in the blood increases again. And this time the CD4 T cells decrease as well. These CD4 T cells eventually drop to the point where it is below 200. Once it reaches this point, the patient will be now diagnosed with AIDS. If not treated properly, the viral load will continue to increase exponentially, which causes the CD4 T cell count to drop drastically until the person's immune system can no longer handle it. The cool thing, not so cool thing about AIDS is that it doesn't kill the person, but what it does is it destroys the human immune system to the point that even a normal flu could kill you. That's how special HIV is. This condition where the patient's immune system is so weak is known as immunosuppression. Because of this immunosuppression, AIDS patients often display AIDS-defining clinical features, and these can include the Kaposi sarcoma, which is the cancer of the connective tissue, tuberculosis, candidiasis of the esophagus, which is also known as yeast growing in your mouth, doesn't sound good, and pneumocystis pneumonia. These 4 AIDS-defining diseases are one of the most common ones that you can see in AIDS patients. There are also many other AIDS-defining diseases, and those are listed out here. Back to Peter. Sounds scary. So how do I treat it? Well, thankfully, Peter, we have medications to control this disease. Would you like to get to know them? Yeah, of course. So here are the treatments that patients with HIV can take. Firstly, a reverse transcriptase inhibitor, and this can be nucleoside or non-nucleoside. Remember how in the pathogenesis, the reverse transcriptase is used to convert the virus RNA to the virus DNA? If we stop this process, then the number of viruses that can continue to reproduce in the CD4 T cells reduces. Also, protease inhibitors can be used, so as integrase inhibitors, fusion inhibitors, and CCR5 antagonists. All of these inhibitors work to prevent the enzymes that HIV ejects into the cell from working. After many years of treating HIV, doctors have set up a treatment plan known as the antiretroviral therapy. And this can include the usage of 2 nucleoside reverse transcriptase inhibitors, with the addition of 1 integrase inhibitor, non-nucleoside reverse transcriptase inhibitors, or protease inhibitor. Back to Peter. I guess we should start treatment as soon as possible, doctor. Of course. But first, we have to inform John and your other partners, because HIV is a notifiable disease. Oh,